by conflict have mental health conditions. We know what conflict is to Africa. We know that there is no part of Africa today that is completely free of conflict. And that also increases the vulnerability to mental health conditions, the prevalence of mental health conditions, and the new cases, incidents of mental health conditions that are coming up in Africa. So we can see the burden of mental health in Africa. This is just giving us the tip of the iceberg for people to discuss. People with severe mental health conditions die 10 to 20 years earlier than the general population. And what is our life expectancy, average life expectancy in Africa? It's less than 50 years, average, when we take average. And when you are taking 10 to 20 years out of that, you can imagine what is left for us. So me and you, we are even lucky to be alive at this time because we are not suffering from mental health condition. Probably we would have gone a long time before now. There is less than one mental health professional for every 100,000 people. You heard what Her Excellency said. In Sierra Leone, psychiatrists, ratio 1 to 1.5 million. It's not different from what we have in Nigeria. It's not different from what they have in Niger or Cote d'Ivoire. So this is a serious challenge that is facing us. And then, of course, we have the issues of human rights violations. And when you talk about human rights violations, then you are not talking about the law. You're talking about legislation. So we will now go and see why do we need these things. Next slide, please. Luckily for us, Africa CDC has come up with a strategic plan, Africa CDC non-communicable diseases, injuries, prevention and control, and mental health promotion strategy, 2022 to 2026. We packaged this thing together and we have started implementing it actually. And you will see how we go. Next slide, please. When we are talking about Africa CDC, what member states can benefit, we'll start from here to look at the mandate of Africa CDC as given by the African Union. So we say Africa CDC has the mandate of African Union to support public health initiatives of member states and strengthen the capacity of their public health institutions, including mental health. A continental strategy that will complement existing national plans. We're not bringing something, remanufacturing the wheel. That will complement existing national plans for mental health activities through provisions of direct technical support, advocacy for increased funding, and the use of peer review mechanisms for cross-cutting learning and monitoring and evaluation. I'm picking this from the strategic plan. So when we are talking about what member states will benefit, how can member states benefit from Africa CDC? This is what we are talking about. Direct technical support, advocacy for increased funding. This strategy can also contextualize global strategies. So we are not alone in the world. We are also looking through the window, looking at what is happening elsewhere. Taking into account the level of health system development on the continent, our own peculiar health system development on this continent, our own unique socio-economic and cultural situation. You heard Dr. Dalla talking about our cultural traditions. This makes us different. It makes us unique in the way that we cannot just carry something from somewhere and come and plant it. And I'm glad that Africa CDC has embedded this within the strategic plan. So when we are talking about the benefit, these are the things we are looking at. Next slide, please. Now, I have tried to do something that at least will generate discussions among us. First, let me mention certain caveats here. When we talk about short-term, long-term, medium-term, there is no discrete line that actually separates short-term from medium-term from long-term. It's very broad and there are overlaps. So some of the things that you are thinking that we'll do short-term will overlap into medium-term. And some things that we are thinking that we are doing medium-term will certainly overlap into long term. So what do we do? How can Africa CDC benefit member states? How will member states be able to tap from what Africa CDC is bringing? First and foremost, Africa CDC has the capacity to help member states, to support member states, for them to be able to identify unique challenges within their own countries and their own demands within their own countries through engagement of these member states, which we have started. We have conducted a leadership training for focal persons. So through this, they will be equipped with the techniques of how to identify challenges and demands. They will be equipped with methodology to be able to do that. And when we talk about building technical capacity to be able to do this, Africa CDC is there, ready to partner with member states to build their technical capacity in order to identify unique challenges and demands of each member state. You cannot solve your problem if you don't know the problem is there. Where will you start from? So first and foremost, you need to see the problem, accept that the problem is there, and now know how to go around it. So that is the first step. And this is quite acute. This is something that we need to do. And for us to do that, it is important that we identify focal persons within member states. And such focal persons will now give them leadership capacity building training for them to be able to know the compass, to have a sense of direction. What do I do first? What do I do second? How will I cross the bridge when I get there? In fact, where are the bridges? How do I identify where the bridges are and know how to cross it when I'm there? So it's not something you just go to the TV and start talking or radio. You need people that will be equipped with the skill to drive what you want them to do. And that is what we mean by identifying focal persons and giving them leadership capacity building. Because they need this technique. It's very important. And Africa CDC has the capacity to work with member states to identify such focal persons and deliver leadership training for them to be able to now change the landscape within their countries. And what do you expect them to do? First, they have to look at the governance structure. What governance structure do you have in place? So presently, we are looking at asking various countries to tell us, what do you have? And when we talk about governance structure, we're talking about policy, we're talking about strategic plan, we're talking about implementation plan, then we're talking about legislation. And one leads to the other. You can't jump. You can't jump. And having a governance structure is telling you that there is a political will by the member states to go into this project. Without a governance structure, you cannot see that political will. Political will is very critical. It's very important. If it is not there, nothing can happen. So when you have governments that come with their priorities, you also want to build this into their priorities and let them buy in. And that is what we mean by governance structure. And this starts with the policy. And when you are developing a policy, that policy must align with the political will of that country. And that policy must also address the health-seeking behavior of the people, because it is a client-centered. So it must address the health-seeking behavior of the people of that country. When they have this problem, how do they go about